Hi, my name is Kyle Morrison. I'm a F&P student with Valdosta State University. This is Carly Morrison. She will be my patient, and this is just to verify that she, first of all, gives consent in the making of this video.
Yes, I give consent.
Okay, good. So this week we're covering the musculoskeletal system. We're going to be covering range of motion exercises as well as resistance. With those range of motions, we're also going to be testing reflexes and doing a neuro assessment with cranial nerves and different sensory tests, things of that nature. So Carly here is a student in the community who has injured herself from New Year's resolution activities. So let's begin. Hi Carly, I'm Kyle. I'm the family nurse practitioner here today. What brings you in today?
I've had a lot of pain in my left side.
Pain in your left side?
Yes.
Okay, where is this pain exactly?
My arms and legs.
In your arms and legs. Any side specifically or?
Yeah, my left side.
Left side? Okay, and how long has this been going on?
About a week.
Okay. Anything make it worse or better?
Working out makes it worse.
Okay.
Better resting and icing.
Okay, good. Do you take any medications for it?
Tylenol, the pain's completely severe.
Completely severe? What do you mean by completely severe? Out of a scale of 1 to 10?
7.
7? Okay. Let's see. Do you have any history of musculoskeletal disorders or issues such as fractures or broken bones, muscle aches, fatigue? Have you had any weakness lately?
No.
No? Okay. Any kind of neurological issues such as nausea, vomiting, dizziness? Any changes in vision?
No.
No? No floaters, changes in memory?
No.
No? Okay. No headaches?
No.
Okay. Any weakness on one side of the body versus the other?
There's pain on the left side, so I guess.
Pain,
Yeah.
but not weakness?
No.
Okay. Any family history of any kind of blood pressure issues?
My dad and mom have high blood pressure.
Okay. Has that resulted in any kind of neurological deficit, such as a subarachnoid hemorrhage, possibly an aneurysm, anything like that neurologically?
No.
No? How about any cervical stenosis?
No.
Okay. Any blood pressure issues with you?
Only when pregnant.
Only when pregnant? Okay. Do you utilize safe workout methods like proper stretching and warming up?
I like to think so.
Okay. Do you drink adequate fluids?
I like to think so.
Okay. What kind of fluids do you drink?
Water.
Water? What else?
That's really it.
Okay. Balanced diet?
Kinda.
Okay. Okay. Let's see. Well, let's go into a little bit of our assessment here and see if we find anything that can kind of point us in the right direction. Okay. So first, we're going to do some range of motion exercises. So first, we're going to start with your neck.
Okay.
So if you would do a little flexion where you put your chin to your chest. Good. Okay. Now look back up. Good. Okay. All the way up. Good. And then back down. Good. So that was against resistance. Go ahead and tilt towards the side. Good. Tilt towards the other side. Good. Okay. Now I need you to look towards my hand. Good. Push towards the other side. Good. Do you need to get that? Okay. We ask that we silence all cell phones if you're going to be in the back office just for privacy. Anyway, so that's the neck. Now we start with the shoulders. Okay, so for flexion of the shoulders, I need you to go up in front of your body above your head. Thank you. All right, then we're going to extend by putting it behind our back. Good, that's far enough. Okay, and then we're going to adduct our arms or our shoulders by putting it across our chest, and then the other arm across our chest. Good. Good. Okay, now one more time with the shoulders. Go up. Good. All right, so far +5 is the strength of all these extremities in the range of motion patterns. So now we're going to test the elbows. So if you would, arms straight out in front of you. Okay, flex them. Good. Extend them. Then we're going to have our palms up. We're going to do some pronation and supination. Okay, back and forth, so no issues with the elbows turning. Now we're going to go to the wrists. So next, we're going to flex the wrist by going down, extension by going up. Good. Now we're going to do a little deviation of the radial and the ulnar. Okay, sorry, radial and ulnar. So we're just going to kind of little scissor kick here. Okay. Good, no issues there. Any pain through any of these range of motions? Okay, good. Do me a favor. I want you to put your arms straight out. Push down. Don't let me push up. Okay, good. All right, turn it the other way. All right, don't let me push down. Yeah, don't let me push down. Okay, good. So +5 strength again as well. Now we're going to test the hips. So if you would, go ahead and flex by straightening your legs one at a time. Good. And then the other one. Good. So go ahead and lay back on the table here. Okay. And we're going to go ahead and lift one leg up in the air. Good. The other leg up in the air. Good. Okay. Now bring your knees to your chest one at a time. Good. Flexion of the knees. Good. Now let's do it one more time with some resistance. Good, 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 good. All right. Good. Any pain? No. Any weakness? No. Okay. So that was flexion. Now we're going to roll over on our belly. Okay. We're going to do extension by one leg at a time. There you go. Same thing. Good. Okay. Let's roll back over. Okay. Let's see. What else can I prod you about? So we did the knees. We did your hips. Let's do your ankles. Let's see. There we go. So ankles, let's do extension. Okay, good. And then flexion, good. And then we're going to do some inversion. Look at the bottom inside of your foot. And then exversion. Okay, then the other foot, do the same thing. Up and down. And then inside and outside. Very good. Okay. Let's see. Take this foot out. Relax. Now push. Good. Okay. Take this foot. Push. Good. Pull. Good. Bring this. And pull. Good. Okay, so you have great strength in all your extremities. Range of motion is intact. Oh. Range of motion is intact for all of your extremities. So let's start looking at a little bit of your neurological side. Okay, so first we're going to be doing some reflexes. Got my handy dandy hammer. It's kind of intimidating, but don't worry. It's just like all the normal doctor hammers you see, but this is a nurse practitioner one, so it's a little bit better.
Okay.
So first we're going to test your brachial. Sorry, not your brachial, your bicep tendon. A good way to find it is flex for me. Good. there's your tendon. So now you can relax. Okay. Now, when I tap, we're going to see your bicep kind of shorten and the tendon retract. Okay. There you go. Perfect. All right. Now, this tendon controls, or not controls, but it's controlled by C5 and 6. Okay, cervical disc 5 and 6. Next, we're going to do your tricep, which is cervical 6, 7, and 8. You're going to relax. Tap. There we go. Okay, relax again. Gonna, still there. Relax and tap. Same concept. There we go. Just a little bit of a shortening of the tendon. Okay. Let's see. Now we're going to do our patellar, okay, which is lumbar 2, 3, and 4. Okay, just relax. Very good. Relax. Okay, and you can palpate the tendon very easily. I would say +2 for the tendon reflexes so far. This could quite possibly count as a 3. Okay, relax. Okay, that's more of a +2. Good. That was a +2 response. Back to the Achilles tendon reflex here, which is the sacral, S1 and 2. Okay. So we're just going to relax your foot, okay? And just a little bit of a movement here, a little flick as we hit that tendon, which is, again, like the patellar, very easily palpable. Okay? Hit my own finger. There we go. Okay, you can relax. Now we're going to continue on with the neurological exam with one more range of motion. It's going to be your spine. That's very important. Yep. And again with that. So let's go ahead and stand up. Okay, let's make sure we're in view. Okay, very good. So to finish off the range of motion, we're going to do a little bit of an extension of the spine where we bend backwards, just a tad. Go ahead. Good. Any pain, weakness?
No.
Okay. Now flexion, where you try and reach your toes. Yep, you did it. Good. All right. Then we're going to go side to side. Okay. There you go. And then we're also, that was lateral movement. Now we're going to rotate back and forth. Good. Okay. So no restriction of any of the range of motion. You had +2 deep tendon reflexes, except for maybe a +3 of the left lower extremity, the patellar tendon reflex, and then +2 everywhere else. Okay. So now we're going to do some sensory tests.
Okay.
So if you would, put your arms straight out. Yep, feet close together, eyes closed. Okay, this is the Romberg. There's no swaying. So therefore, we have a negative sign, which is good. Now I need you to tell me, which hand am I touching?
The left one.
Left. Good. Is it high or low?
High.
Good. So proprioception's intact. Let's just double check. How about now?
Right down.
Right down. Good. Proprioception's still intact. Keep your eyes closed. Do me a favor. Hold out your right hand. What is that object?
A pen.
Good. I'll take that back. Can you tell me what this is?
Like a plug-in charger.
Very good. I will take that back. Okay. Very good. So that was stereognosis, where the patient is able to tell what the object is in their hand. The other test we like to do is the tandem walking. Okay, so go ahead and do heel to toe, 3 paces. Heel to toe. One more. Turn. Good. Heel to toe, 3 paces. Okay. Talking. Tandem walking's intact. No disturbance in gait. Let's see. Okay. Now I need you to. We're going to do another neuro test here where we're going to do a rapid movement test, rapid maneuver test. I need you to take your finger and touch my finger. Good. Now touch your nose. Now my finger. Do it quickly. Good. Okay. Now do the same thing with the other. Very good. Okay. So that's intact. So now we're going to also do cranial nerve testing. Okay, so first let's check out cranial nerve 1. Okay, I have a scent here for you, and I need you to tell me what it is.
Peppermint.
Very good. Did it relieve all stress of working out? Hopefully. Good. Okay, so now I have a little flashlight here. We're going to check cranial nerves 2 and 3 by looking at pupillary response. So if you would, look at my nose. Okay. 3 round reactive to light. 3 round reactive to light. Keep looking. Look at my finger. Good. Accommodation noted. Okay, so perla. Now I need you to follow the light with the 6 cardinal fields of gaze. Down. Right. Good. Good. Okay, so that was cranial nerve 6. So we've done 1, 2, 3, 4, 6, 5, and 7. For that, we're going to raise the eyebrows. Good. We're going to puff out the cheeks. Good. We're going to grin and then bear down on your teeth. Okay. Good. We're going to frown. Good. Cranial nerves 5 and 7 are intact. Let's see. Cranial nerve 8. What do you hear?
Rubbing.
Good. How about now?
Crinkling.
Crinkling. Good. Okay. Cranial nerve 8 is intact. Cranial nerve 2. Okay, got a Snellen chart here. We're going to read the top, cover your, there you go. Cover one eye. We're going to read the top here.
9-5.
Okay, read this line with the other eye.
2-8-4-3.
Okay, very good. So cranial nerve 2 is intact. 5, 7, 8, 9, 10, and 12. Let's do stick out your tongue. Okay, open wide. Move your tongue side to side, up and down. Up and down. Not just the tip, the whole thing. The whole thing. Okay, good. All right, so no deviation, forced deviation of the tongue. Go Good. Uvula and soft palate rise. So 9, 10, and 12 are intact. And then 11, if you would, just one more time, shrug the shoulders. Good. Okay. So you were able to resist, and so cranial nerves are intact. And that's about it. Everything checked out. So honestly, I think maybe I'm going to write you up, but I think we're probably going to have to go over some different nutritional guidelines to help fuel your workouts. Maybe get you with a registered dietitian, and then maybe go with an athletic trainer who can guide you in appropriate stretching techniques, different workout routines, and proper lifting form. And I think maybe that's what we're dealing with here is maybe a muscle strain. Okay. So in the meantime, since you said your pain level is a 7, Tylenol is usually pretty good, but with it being that high, we need to look at something a little bit more powerful, such as like ibuprofen, 800 milligrams, or even quite possibly something like a hydrocodone, with acetaminophen and codeine, something of that nature. It is a narcotic, but not quite as addictive as people think. Very low dose, and it's just as needed every 6 to 8 hours. Okay, and then you would just use Tylenol or ibuprofen for breakthrough pain. I recommend ibuprofen because it tackles more than inflammation. Okay. Any other questions or concerns? Okay. All right. Well, follow up with us in a couple weeks. Okay. Make another appointment, and so we can see you again and make sure that these pains have resolved. Okay. So good luck. All right. That's it.